The average person takes about 4,000 steps a day, and depending on your job or lifestyle, you could be taking a lot more, which is why it's so important that we care for our feet. I'm at Elite Foot and Ankle Associates today with Dr. Trevor Haynes. Hi.
Hi, how are you?
I'm good. Thanks for joining me today. Okay, so tell us what sets Elite Foot and Ankle Associates apart.
Yeah, I think Elite Foot and Ankle, obviously we're podiatrists. Our goal is really the feet and the ankles. But I think what sets us apart is we're not just like some podiatrists are focused on just surgery, some are focused on no surgery. I think we really try to embrace the whole foot and the lower extremity, and we treat anything from surgeries, we do wounds, we do at-risk foot care. I mean, you name it. If it involves the feet, we do it.
Yes, and one of those things that you're specializing in is wound care.
Correct.
Yeah, tell us more about that.
Yeah, so we do a lot of wound care here. So people get wounds for various reasons, and we find most of them are diabetic wounds that we see here. But people can get wounds from surgical issues and wound healing issues, but wound care is an area that we really focus on because there's just so many people out there with wounds that likely aren't getting treated appropriately.
Yeah, and you treat everything from the knee down in terms of wound care, which I would think would be a particularly tough place to have a wound, especially on your feet.
Yeah, I mean, most diabetics that have them, they're neuropathic, so they don't feel it, which is part of the reason they get it. But a lot of other people, like at facilities and that are homebound, will get pressure sores, which are a problem for them as well.
Yeah, and you are doing mobile wound care.
Correct.
Talk to us about that.
Yeah, so what we found is a lot of wounds that are not being treated appropriately is because the patient doesn't have that ability, if they're homebound in a facility or thing, to get to the doctor's office, and it's difficult for their family and even their facility to coordinate all that travel and doctor's appointments to be able to get the care that they need. So we offer the ability to go to their home and treat those wounds appropriately, which includes, debriding the wound, which really helps it heal, and potentially other adjunctive procedures to really help those wounds, whereas currently they're probably just getting wrapped.
I see. And you also use something called skin substitute. So tell us about that.
Yeah, so skin substitutes are usually derived from human tissue, almost like you could say cadaver-like tissue, but so they look a little bit like just a thin piece of paper. And like this one here, they're derived from placental tissue. And with these grafts, we can clean up the wound, apply these directly on, and they can drastically heat up the healing time.
Yeah, and sometimes it sounds like these wounds aren't getting treated often enough, which is kind of,
Correct.
Is that why you decided to go to them, right?
Yeah, it's proven that if a wound is not debrided and cleaned up on a weekly basis and getting that adequate wound care, it's given no chance to heal. So a lot of patients, they'll have home health and they'll have these other people coming in to help, but they can really just rewrap the wound. Unless they see a physician or someone similar, those wounds aren't getting cleaned up, which is really it's really detrimental to the healing process.
Yeah, sure. Okay, let's talk about insurance and what kind of insurance you accept here.
Yeah, we accept all insurances for the most part. As far as wound care goes, every insurance is going to cover wound care. When it comes to skin grafts or these skin substitutes and putting those on, Medicare is the easiest to deal with. We can work with some other insurances, but of course, if you're on a MedAdvantage plan or a commercial plan, there tends to be more of a cost to the patient for putting these kinds of things on.
I see, and you can help guide the person through that and answer any questions.
We do all that process and verify everything, and we'll let the patient know if they had any responsibility towards getting that care.
Yeah, that's great, so helpful. And okay, tell us how people can contact you and if they want to discuss wound care with you.
Yeah, so we have multiple offices, but if you call our home number at 503-668-5210, or you can go on our website at elitefaor.com. We do have a booking link on there, and if you just want information, just call. Our staff is very knowledgeable as far as what we can do, and they can explain everything to them.
That's great. All right, thank you so much for the information. Appreciate it.
Yep, no problem.